Hello friends, today we are going to see what are all the patient safety incidents are there. In the CPHQ there is a separate chapter for patient safety. In that they are discussing about all the patient safety incidents. We'll see one by one. There are several events. So step by step I have explained here. The first one is hazardous environment, then near miss or good catch, no harm, adverse event which is acute, and then sentinel event, and there is one more part which is in sentinel event is never event. This is also a form of sentinel event. We will see one by one. A hazardous or unsafe condition is a circumstance other than the patient's own disease process or condition that increases the probability of an adverse or sentinel event. For example, the patient is going to washroom. A slippery floor is a hazardous or unsafe condition. Next one is near miss. Any unplanned event that could have caused physical injury or potential harm but did not happen. For example, the patient who went to the washroom, she was about to slip and fell down, but you just holded her. So the patient did not underwent any patient fall. So this is called near miss. The next one is no harm. A no harm event is a patient safety event that reaches the patient but does not cause harm. For example, the patient fell down, but luckily she held the grab bar and she sat on the floor. Nothing happened to her. But the incident happened, but there is no harm. So this is coming under no harm. Next one is adverse event. An adverse event is a serious, undesirable, and usually unanticipated patient safety event that resulted in harm to the patient but does not rise to the level of being sentinel. This is actually an acute event. The reverse to the normal health is very short. Next is sentinel event. A sentinel event is a patient safety event not primarily related to the natural course of the patient illness or underlying condition that reaches a patient and results in a death, permanent harm, or severe temporary harm. Again, that results into death, permanent harm, or severe temporary harm. So what do they mean temporary harm? It is defined as a critical, potentially life-threatening harm lasting for a limited time with no permanent residual but requires transfer to a higher level of care, monitoring for a prolonged period of time, transfer to a higher level of care for a life-threatening condition, or additional major surgery, procedure, or treatment to resolve the condition which is not actually related to the natural course of the illness. And also these sentinel events are called sentinel because they signal the need for immediate full investigation and response. Events subject to review include any events that meet the following criteria. We'll see one by one. Number one is suicide of any individual receiving care, treatment, or service in a staff round-the-clock care setting or within 72 hours of discharge, including from the hospital emergency department, not only from the IP. Even they took care from in your emergency department and they left within 72 hours. If they are committing a suicide, that is also coming under sentinel event. Number two is unanticipated death of a full-term infant. 3. Discharge of an infant to the wrong family. 4. Abduction of any individual receiving care, treatment, or services. Any elopement, that is unauthorized departure or abscond of a patient from a staff around the clock care setting, including emergency department, leading to death, permanent harm, or severe temporary harm to the patient. And also sexual abuse or physical assault and homicide or sexual abuse or assault. Sexual abuse, assault of any patient while receiving care, treatment, and services while on site at the organization, facility, or while under the supervision or care of the organization. Sexual abuse, assault of staff member, licensed independent practitioner, visitor, or vendor while on site at the organization, facility, while providing care, supervision to the patient or clients. Physical assault of any patient or client leading to death, permanent harm, or severe temporary harm while receiving care. treatment, and services while on site at the organization, facility, or while under the supervision of care or the organization. Physical assault leading to death, permanent harm, or severe temporary harm of a staff member, licensed independent practitioner, visitor, or vendor who is on facility. And then homicide of any patient or client while receiving care, treatment, and services while on site at the organization, and homicide of a staff member, licensed independent practitioner, visitor, or vendor while on site at the organization. Sentinel Event 7, administration of a blood or blood products having unintended ABO and non-ABO incompatibilities, hemolytic transfusion reactions, transfusion resulting in a severe temporary harm, permanent harm, or death. Surgery or other invasive procedure performed on the wrong patient at the wrong site or wrong procedure for the patient. Then, unintended retention of a foreign object in a patient after an invasive procedure, including surgery. Then, prolonged fluoroscopy with a cumulative dose greater than 1500 rads to a single field, or any delivery of radiotherapy to the wrong body region, or greater than 25% of above the planned radiotherapy dose, is also a sentinel event. Fire, flame, or unanticipated smoke, heat, or flashes occurring during the direct patient care caused by equipment operated and used by the hospital to be considered as a sentinel event. Equipment must be in use at the time of the event. Staff do not need to be present. Any intrapartum maternal death and severe maternal morbidity when it reaches a patient and results in a permanent harm or severe temporary harm. Severe neonatal hyperbilirubinemia. And then fall event, fall resulting in any of the following, like fracture, surgery, casting, or traction, required consult, management, or comfort care for a neurological or internal injury, or a patient with coagulopathy who receives a blood product as a result of a fall, death or permanent harm as a result of injuries sustained from the fall. These things also considered as a sentinel event. Now we will see what is a never event. A never event, as per the AHRQ and leapfrog term, referring to adverse events that are unambiguous, which is clearly identifiable and measurable, serious, resulting in a death or significant disability, and largely preventable. You have to underline this word here, largely preventable. Sentinel event may be or may not be preventable, whereas the never event is completely preventable event, and only because of the negligence it is happening. So National Quality Forum lists there are some serious reportable events as a never event. We will see what are all those events. Number 1 is surgical and procedural events. Surgery or other invasive procedure performed on the wrong body part. Surgery or other invasive procedure performed on the wrong patient. Wrong surgical or other invasive procedure performed on a patient. Unintended retention of a foreign object in a patient after surgery or other procedure. Intraoperative or immediately postoperative post-procedure death in an American Society of Anesthesiologists Class 1 patient. And number 2, product or device events. Patient death or serious injury associated with the use of contaminated drug, device, or biological provided by the healthcare setting. Biologics, what they mean here is many skin graft, all those things, as per my guess. And then patient death or serious injury associated with the use of function of a device in a patient care in which the device is used for function other than as intended. Patient death or serious injury associated with the intravascular air embolism that occurs while being cared for a healthcare setting. Then patient protection events. Discharge or release of a patient or resident of any age who is unable to make decisions to other than unauthorized person. So you are discharging them to the wrong family or person or unauthorized person. Next one is patient death or serious disability associated with the patient elopement or disappearance. And then patient suicide, attempted suicide or self-harm resulting in a serious disability while being cared for in a healthcare facility. And care management events, patient death or serious injury associated with the medication error, patient death or serious injury associated with the unsafe administration of blood products, maternal death or serious injury associated with labor or delivery in a low risk pregnancy while being cared for in a healthcare setting. So here they are not mentioning about the high risk pregnancy. If it is low risk pregnancy and again maternal death is there, it is considered as never event. Death or serious injury of a neonatal associate with labor or delivery in a low risk pregnancy, artificial insemination with a wrong donor sperm or wrong egg. The patient death or serious injury associated with a fall while being cared for in a healthcare setting. Any stage 3, stage 4 or unstageable pressure ulcers acquired after admission, presentation to a healthcare facility. Patient death or serious disability resulting from the irretrievable loss of an irreplaceable biologic specimen. Patient death or serious injury resulting from failure to follow or communicate laboratory pathology or radiology test results. The environment events, patient or staff death or serious disability associated with an electric shock in the course of a patient care process in a healthcare setting. Any incident in which a line designated for oxygen or other gas to be delivered to a patient contains no gas or the wrong gas or is contaminated by toxic substances. Patient or staff death or serious injury associated with the burn incurred from any source in the course of a patient care process in a healthcare setting. Patient death or serious injury associated with the use of restraints or bed rails while being cared for in a health care setting. And radiologic events, a death or injury of a patient or staff associated with the introduction of a metallic object into a MRI area. Then the criminal events, any instance of a care order by a provided by someone impersonating a physician, nurse, pharmacist or other licensed healthcare provider. Abduction of a patient or resident of any age. Sexual abuse, assault on a patient within or the ground of the healthcare setting. Death or significant injury of a patient or staff member resulting from physical assault that occurs within or on the ground of a healthcare setting. Thank you.